All right, for all my night shifters out there, which I worked for my first 4 years out of nursing school, how do we help with breastfeeding at night, especially if you've never had a baby, never breastfed, or maybe it went super easy for you and you don't know how to help people who it's not going super easy for. Let's talk about how you can help our moms succeed with breastfeeding at night. So, the first thing is baby behavior. It is so helpful to tell the parents about baby behavior before it happens. So, for first time parents, obviously, this is really important. They may have never heard of this. For follow up parents who have kids at home, they might not remember what it was like to have that newborn. So, reminding them of what to expect with their baby can be really helpful so they don't freak out when it happens. We have a little sheet in our lactation drawer in postpartum about baby's second night. So feel free to grab it and hand it out so they can have something to read after you've left the room. So the first day, we expect our babies to be pretty sleepy after those initial 2 hours. The average baby only shows feeding cues 6 times. They can be hard to wake up. Lots of parents talk about how what a great baby their child is. They're pretty sleepy. That second day, oftentimes that second night, they wake up a lot more. And when they wake up a lot more, they just want to live on mom. I like to tell parents it's not because their baby is starving. It's not because mom doesn't have enough milk. It's because mom is familiar. She has the same heartbeat and breathing, stomach sounds, and voice that they're used to, all those same sounds. She's warm, she has food, and the bassinet doesn't have any of those things. So lots of times when they're placed in the bassinet, they start to show feeding cues right away to get back to mom, who is familiar. She's the closest thing that they have to everything that they know, which is being in the womb. So lots of times when they get back to mom and they get comfortable on her chest, they realize that they're safe there, that they can thrive there, and so they fall asleep. If parents are struggling through breastfeeding at night with this second night, and it can happen on the first night too, that's just what we see a lot of the time, you can help them. So first thing to do is to help mom to get a good latch. Try to resist the urge to say, let me just take the baby so you can get some rest. That can be helpful in some scenarios, but it's certainly not the first thing that you want to offer. It's probably not the second or the third either. It's not the most helpful in those ways. So first thing would be help mom to get a good latch. You can take a look at our latching video if that's not something that you're really familiar with. But the better latch she has, the more milk baby's going to transfer and the more satisfied baby will be. So help her get latched on really well on one side. I would highly encourage her, or you, if she's, really sleepy and she needs extra help with your hands too, to do some breast compressions while the baby is nursing to help the baby transfer more milk than what his effort is doing. When he comes off or he falls asleep or mom thinks he's done on that side, take him off, burp him, and then have her offer the other side. Again, try to do some nice breast compressions. You want to keep the feeding a feeding instead of letting the baby just latch and then doze off, because then you kind of have this constant thread of feedings. Baby just wants to nurse constantly instead of we're going to start the feeding, we're going to feed baby really well, we're going to do all the things we can to keep them awake and transferring milk, and then we're going to end the feeding so mom can sleep. So after nursing on that second side, he probably fell asleep while doing that. Have someone, whether it's mom or dad, hold him until he's in a deeper sleep. So this might mean he unlatches himself or she realizes he's asleep. She does a breast compression. He doesn't wake up. She unlatches him gently and just keeps him very close to her breast in her arms for about 10 minutes so that he can fall into a deeper stage of sleep before she lays him down in the bassinet. When he's in that deeper stage, of sleep, then lay him gently down in the bassinet, and hopefully he will sleep for a few hours so that she can sleep. And then she needs to immediately sleep also, and try not to get distracted by updating her Facebook posts and things like that. So that's a great thing to encourage her to. Once baby sleeps, falls asleep, you fall asleep, so that way your few hours doesn't get eaten up. One of the most helpful things you can do to help parents handle breastfeeding at night, and this would be a day shift thing, is to encourage supper time naps. Naps of all kinds are good, and I like to tell my patients that they're essential. It's not this luxury that they're giving themselves, because they tend to fight that idea. They're not used to taking naps. They're used to being efficient and using all of their time and go, go, go. But naps are no longer optional, is what I tell my friends the first few weeks after they have a baby. They, at this point, when they've just had a baby and they're at day 2, they probably haven't slept much in the last few days due to Braxton Hicks or a long labor or just being uncomfortable and waking up to pee in the middle of the night, and they're probably already sleep deprived. So taking a nap at supper time can be a game changer for how well they can handle those nighttime hours. And it sounds silly when you come to it and you're that parent, because you think, well, I'll just go to bed at 8:30. I'll just go to bed at 9. I'll just go to bed really early so that I can catch up on my sleep. But what if at 9 is when baby wants to wake up and cluster feed until midnight? Now you feel like you're losing your mind. So if you take a supper time nap at 5 or 6 or 7, something like that, it can make the parents handle those nighttime feedings entirely differently, which is going to set them up for success at home and for the rest of their parenting. So rooming in, more breastfeeding success is seen when babies spend 23 out of 24 hours in their parents' rooms. So we want to try a bunch of different things before we just take the baby away to let parents sleep. So let's talk about how they can survive these cluster feedings. If baby is continually wanting to feed and mom is done, have her express some of her milk into a spoon. Just with her hands, it'll take, 5 minutes. Whatever she can get out, give to dad with the spoon and the baby. Have mom go to sleep, and if she's at home, have her go to sleep in a separate room. But if they're in the hospital, have her just lay down, close her eyes, turn off all the lights, and have dad spoon feed that baby the milk that mom got out. After he spoon feeds the baby, which is sort of baby's like top off or dessert, then he's going to give baby consistent calming measures until the baby falls asleep. So whatever dad feels most comfortable with, or whatever support person is there, this could be, my favorite is to put the baby's face up against my cheek and give them like a little bounce. You want consistent motion, consistent sight, so maybe you lower the lights or you turn the lights all the way off to decrease their visual stimuli, and then consistent sounds, so maybe that's a shushing sound. It's okay to use whatever comes naturally to you. Whatever you pick, you want to stick with it instead of keep changing things up. So dad gives consistent calming measures until the baby falls asleep, and then he can lay the baby down, and after a bit of sleep, they both wake up with fresh attitudes. Now, with an overstimulated baby, that can take a while for them to calm down. So I always like to tell parents, look at the clock or set a timer on your microwave so you know that while this seems like it's been forever, it's only been 10 minutes. The average overstimulated baby can take 15 minutes to calm down. So it can be nice for them to have a clock check to know it hasn't been all that long. Nipple shields. Most moms do not need nipple shields. They don't need nipple shields if they have flat nipples. They don't need nipple shields if their baby can't latch. They don't need nipple shields if they're in pain. They are just a tool, but they're a tool that we don't want to overuse. So nipple shields aren't recommended within the first 24 hours. So if you're within that window, try to see what other things you can do to not pull out the nipple shield. Now, if she already had a baby and she used a nipple shield with that one and she loved it, and she really wants to use a nipple shield with this baby, like, you don't need to hold them hostage. It's fine to give her a nipple shield, but I would tell her when you do that they're not going to recommend it in the first 24 hours, and see if she wants to hold off. So what babies with flat nipples need is just a lot of skin to skin and a lot of practice. They don't actually latch onto the nipple. They latch onto the whole breast. So you want to wait if you can and not pull a nipple shield out right away with the first struggle. One of my favorite uses for nipple shields is if it's nighttime and mom is just like, I give up. Latching this baby is too hard and I don't want to do it anymore. That's a great time to be like, what would you think about trying a nipple shield? Maybe it will make latching just enough easier that she'll want to keep going and keep going. So just don't have it be your first go-to. Remind yourself you have a lot of other information, including how to help this baby latch deeper, and holding skin to skin, and hand expressing into a spoon, and spoon or finger feeding, that you can use before you jump to that nipple shield. Another good thing to ask yourself on the night shift is, should this mom be pumping? Sometimes babies are born and they're not nursing all that well, but they're still really young, and so it's not quite time to pull out a breast pump and get mom pumping. But when we get to night shift, sometimes throughout that night, it becomes that time to pull a pump out and get mom pumping. And when we wait, by the time lactation has seen them the next day, we might have gone a whole nother 12 or 18 hours where mom could have already started expressing extra milk to help correct whatever isn't going very well with babe. So ask yourself, should this mom be pumping? Is baby not latching? Are they not latching well, or not transferring milk when they latch? Do they just latch and come off, or latch and fall asleep? Are all of their feedings just lasting a minute? If that's the case with this baby and it's been 12 hours since delivery and mom hasn't started pumping, it's time to pull out a pump and teach her how to use that. It doesn't have to be a big deal. You don't have to make it really stressful. Just in a kind, casual manner, just get her started so that her milk supply won't be behind, but can be ready for that day 2 and night 2 with baby. And then her goal would be to express milk every few hours, or 8 to 12 times each day. So that could be through with baby nursing, or with hand expression, or with using the electric breast pump. And if she already brought a pump with her, then she could use her home pump. Or if she has one that lactation has given her through her insurance, she could use that pump. And if she doesn't have either of those, then you can pull out one of our hospital grade pumps for her to use. Thank you so much for taking great care of our mamas at night. They really rely on our night nurse care for them to help them get breastfeeding established, because our babies eat all throughout their 24 hours. So thanks again for helping them, and thanks for watching this video.